Alors, dans un premier temps, on va entendre Karen Synesiou du Center for Surrogate Parenting. Donc elle va nous dresser un historique sur la gestation pour autrui aux États-Unis, parce qu'elle a une longue expérience dans ce domaine. Ça se compte en dizaines d'années, mais je ne vais pas trahir son âge. Elle va aussi évoquer le processus, ce qu'on appelle le processus de double choix, c'est-à-dire la rencontre entre les parents intentionnels et la mère porteuse. Évidemment, pour des couples hétérosexuels comme pour des couples homosexuels. Voilà, Karen.
Bonjour. That's the extent of my French, I'm afraid. So our program has been around for 31 years. We are the oldest surrogacy agency in the world. We have participated in many seminars, as we are having here today. And this is how surrogacy began in the United States. It began with an idea, and then as we started speaking to professionals, lawyers, professors, child social workers, we formed what came to be the Center for Surrogate Parenting and the standard of care, which most of the industry now adheres to. So what I'm going to do is take you through some of the standards of care that have begun in the United States and that most programs follow. And this hopefully will give you an outline of how surrogacy should be done.
Bonjour, notre programme a 31 ans, ce qui fait que nous sommes l'agence la plus vieille au monde. J'ai participé et je participe à différents séminaires, comme celui qui est organisé ici aujourd'hui, et je souhaiterais commencer par vous expliquer comment notre agence est née aux États-Unis, comment est-ce que cette idée est née. Elle est née grâce au travail de professionnels, d'avocats, de travailleurs de l'enfant. C'est ainsi que notre agence est née. Donc je voudrais également vous parler de comment tout fonctionne aux États-Unis et comment nos programmes sont suivis par la plupart des agences qui existent aux États-Unis aujourd'hui.
So the first one is that a surrogate mom should be over the age of 21 years. I know there are some places that might work with a surrogate mom under the age of 20, but I'm actually unaware of any doctor's office that will work with any surrogate mom that is below the age of 21, and I think that's something that we should really stick to. The second thing is that a surrogate mom must already have given birth to a child. You don't want to work with a surrogate mom who has never had childbirth herself for a multitude of reasons that we can all discuss another time, but the standard rule in our industry is every surrogate mom has given birth to a child. Every surrogate mom must be psychologically screened before she can become a surrogate mom. And this can be a 1-hour interview, it could be a process over 3 to 5 months, but what is important is that she needs to see a psychologist and really understand surrogate parenting, and we need to understand her motivations for being a surrogate mom and how to work with her personality. Then there are a few standards which most agencies comply with, but not all, and you will understand as I go through them. But I think these are important things for everyone in the room to consider.
Donc quels sont ces principes que nous essayons de suivre? Tout d'abord, les mères porteuses doivent avoir plus de 21 ans. Il est vrai que certaines agences travaillent avec des mères porteuses qui ont moins de 21 ans. Mais de moins en moins de cliniques médicales le font aujourd'hui. Et je pense que c'est un principe sur lequel il faut réellement insister. Deuxièmement, il faut que les mères porteuses aient déjà eu des enfants. Nous ne travaillons pas avec des mères porteuses qui n'ont jamais eu d'enfants, ça a plusieurs raisons dont nous pourrons débattre plus tard, mais c'est réellement un principe clé que nous cherchons à suivre. Troisièmement, chaque mère porteuse est suivie psychologiquement. Elle subit toute une série d'examens, de tests psychologiques. Ça peut passer par un entretien d'1 heure, mais ça peut aller jusqu'à 3 ou 4 mois de tests. Cela pour évaluer sa psychologie, évaluer ses motivations, comprendre réellement pourquoi elle veut faire cela et apprendre aussi à la connaître. Alors il y a d'autres normes qui sont suivies par certaines agences et je vais y venir maintenant.
The first thing is that a surrogate mom should have the right to choose the parent or parents that she works with, without any repercussions from the agency that she's with. She should have a right to look at a profile, read the profile and say, yes, these are people that I want to work with, or, you know what, I don't have so much in common with them, show me someone else. I think it's really important that the surrogate mom gets choices. And in the same way, I think that parents should get a choice. You should get a choice of surrogate moms look at the profile and see if there's anything about her profile that makes you feel comfortable.
Donc pas toutes les agences, comme je le disais, suivent ce principe. C'est le principe qui veut que la mère porteuse puisse connaître les parents avec lesquels elle va travailler, et de la même façon que les parents puissent connaître la mère porteuse, regarder son profil, comprendre qui elle est, et de la même façon, la mère porteuse doit aussi pouvoir regarder, consulter le profil des parents et savoir si quelque chose la touche et pouvoir choisir avec qui elle veut travailler.
The second thing is that a surrogate mom should be able to walk away from being a surrogate mom at any time prior to being pregnant without any financial burden. So if she thinks she can be a surrogate mom, but then later on says, I just don't think that I want to do this anymore, she needs to be able to walk away from that relationship. And even though the intended parents and the agency would have incurred substantial costs, that's a risk which we must take. She needs to be able to walk away.
La mère porteuse doit aussi pouvoir cesser d'être mère porteuse si elle le souhaite, même si ça peut être difficile pour l'agence, pour les parents intentionnels. Il faut qu'elle puisse par la suite cesser d'exercer cette fonction si elle le souhaite.
A surrogate mom must have completed her family, or at least believe that she has completed her family. Every pregnancy could be a risky pregnancy. And that means that when she gives birth, she could lose her uterus and never have another child. So you want to really speak to the surrogate mom and her husband or her partner and say, do you really believe your family is complete? And if she says, no, I think I still want to have one more child, then we need to encourage her to go and complete her family before she becomes a surrogate mom.
De la même façon, il faut que la mère porteuse estime qu'elle ne veut plus avoir d'enfants, que sa famille est complète, car toute grossesse est une grossesse à risque, on peut perdre son utérus au cours d'une grossesse. Il faut réellement qu'on lui demande si elle veut encore avoir des enfants plus tard. Si elle répond que c'est le cas, eh bien là on doit l'encourager à poursuivre son projet personnel et à ne pas être une mère porteuse.
There must be psychological counseling and support offered to the surrogate mom and her family before she gets pregnant, throughout the entire pregnancy, and even after pregnancy, so that she can get access to a professional if she wants to speak to someone without any cost burden to her family.
De la même façon, la mère porteuse doit être conseillée, elle doit être soutenue psychologiquement par un psychologue. Cela avant sa grossesse, pendant sa grossesse, mais aussi après. Elle doit avoir accès à ce type de soins, même si cela représente un coût additionnel.
A surrogate mom should not be receiving any welfare benefits. If a surrogate mom receives welfare benefits, then by her being a surrogate mom and receiving compensation, we could affect those benefits that she gets, because in many states, any income that she gets will be counted towards her welfare benefits, and therefore the basis of her being able to pay her bills and to live, the money that she uses to live on, could be in jeopardy because of surrogacy.
De la même façon, la mère porteuse ne doit pas recevoir de compensation financière supplémentaire. Aux États-Unis, elle doit, nous faisons en sorte qu'elle puisse payer ses factures, vivre de l'argent qu'elle recevra, mais elle ne doit pas recevoir d'argent supplémentaire à cause du fait qu'elle soit mère porteuse.
So in essence, what we're trying to do is really understand who the surrogate mom is and give her as much support as we can through the entire relationship. And we're evaluating her not as an individual, but her as part of an entire family. We're evaluating their income, we're evaluating her motivations. We want her husband or partner to be part of this relationship. We need to speak to the husband or partner and see how he feels about surrogacy. If she has a husband or partner that is not really interested in surrogacy and doesn't want his wife to do this, then she must not be a surrogate mom, because we could then be the reason why they get divorced. And you don't ever want to do that to a surrogate mom and her family, and especially her children. So in evaluating a surrogate mom, and the reason why we have some of these industry standards is we're trying to protect the surrogate mom and her family and give the healthiest, most mature, most psychologically sound surrogate mom to an intended parent who very much wants to parent a child. Thank you.